Despite the end of Mental Health Awareness Month in May, us here at Channel 3 will still be bringing you more on our Mental Health in Sports series. This week, we peel back the curtain on the medical side of things and how doctors and trainers treat mental health issues.
So it is out there, it's real. Recognition is vital. I don't think we have enough people that, that are trained necessarily to not only identify it, but also then to treat it.
Student athletes at every level are encouraged to speak up if they're struggling with their mental health. It's the first step, and in some cases, only one in order to get help. So when they do, what happens next?
In just about every case, the understanding the foundational cause, if you can, obviously talking through and hopefully coming to a point where you can understand, okay. But at the end of the day, I think recognizing the issue and getting them in the hands of mental health professionals that understand, how to get to the root cause of those things helps the most.
Therapy, counseling, and in more severe cases, medication is the main focus for medical professionals treating mental health issues. But treatment plans aren't the issue. It's the stigma that's ultimately preventing student athletes from getting the help they need.
Obviously, the statistics say, at least 75 to 80% of kids in that age have been affected by either anxiety or depression. And certainly that statistic is borne out, if you will, in the athletic population. However, I think fewer of those kids bring it to the attention of a professional. That's the problem, is again, they are taught to basically just suppress it and go on and keep going until sometimes it's too late, and that's what we hope to prevent.
As more awareness arises and more student athletes feel okay to speak about their personal struggles, a shift in how we perceive these issues from a day-to-day, game-to-game basis may just help the goal of tearing down the stigma altogether.
Early recognition and understanding that it is an important issue as concussion is, and ankle injury is, and we've done a lot of work on those to make sure that we rehab and we don't return a player to play who's recovering from a concussion. I think we need to look at it in the same light, in that, and bringing attention to the fact that it's a real issue, that it sometimes requires time out, a trip home, And I love the fact that coaches are getting trained to look for signs and to have a more positive, encouraging approach.
And to give you an example of players trying to treat mental health issues like any other injury, Philadelphia Eagles lineman Brandon Brooks left in the middle of a game due to illness from his anxiety. He even missed a few games. Brooks has been very open about his struggle in hopes of helping others deal with their problems. Next week, we'll take a look at the coaching perspective and how they're much more inclined to listen now than in the past.